Today's Inside Tract podcast is part of the Global Perspective series, which is brought to you by the AUA International Programs Department. We'll hear from scholars of the past and present as they talk about what they've learned, how they plan on applying those lessons, and the impact of international collaboration on their professional growth, research, and patient care.
Welcome to AUA News Inside Tract. I'm Dr. Mark Gonzalgo, Professor of Urology at the University of Miami and Chair of the AUA Office of Education.
I am Dr. Rigoberto Pallares. I'm an attending urologist at the Hospital General Tijuana, and I'm also an attending urologist in the private setting at Hospital Ángeles, Tijuana.
Today we're continuing our Global Perspectives series by highlighting the AUA Exchange Scholar experience. We will be talking about Dr. Pallares' experience coming to the United States from Mexico and working with our group in Miami. Dr. Pallares, thank you for joining us today.
Thank you very much for having me here. I'm so glad to be here and having this interview with you.
Before we dive into the exchange experience, let's step back a bit and talk about your journey. How did you find your way into urology, and what sparked your interest in robotic surgery in your practice in Tijuana?
Well, I must admit that I didn't know I wanted to be a urologist at first. This happened until the last month of my clinical rotations during the medical school. My dad's an internist, so I think I grew up with a very clinically oriented view of medicine. I admired what he did, and during my rotations at the National Institute of Health in Mexico City, I happened to rotate through the urology service. This was by chance. And that's when I knew that the urology field was very broad and interesting. And that's when I decided to continue my path in urology. Later, I continued my career and I completed my residency program at the University Hospital in Monterrey, Mexico. And ultimately, I did my fellowship in Rome at the National Cancer Institute, Regina Elena. I chose robotic surgery because I was amazed by doing complex procedures through minimally invasive approaches. And this led me to this way. Finally, I returned here to Tijuana because I grew up here, and I think there's still a lot of work to do here.
So, obviously career paths in robotics are highly variable globally, but I think intentional training and mentorship, some of which I'm sure you've had much along the way, are universal drivers of excellence. Rigoberto, what inspired you to apply for the AUA Exchange Scholar program?
Well, I'm part of the Young Urologist Office from the Mexican Society of Urology, and the program was promoted inside the group. And at first, I hesitated a little bit because I needed to coordinate the program with my workload. But finally, I decided to apply, and things got well. So I think it was a good decision.
So once accepted, the real learning begins, not just in the operating room, but in understanding an entirely potentially different healthcare ecosystem. When you first arrived in Miami, what stood out to you about the healthcare system in the United States compared to Mexico?
Well, it is very different, and I think I admire and respect the healthcare systems that provide high-end treatments to its patients. And that's how it should be. I think everyone should have access to these advanced procedures. That would be, for example, robotic surgery, and seeing centers where robotic surgery is accessible to anyone. And for example, where a urology service can perform 2 to 3 robotic surgeries in 2 to 3 simultaneous operating rooms, I think that tells me that things are being well done. Things are that the hospital is doing things right. I mean, in Mexico, particularly in my city, I often feel like a social advocate, maybe, because robotic surgery works, yes, but it works mainly in the private setting. On the other hand, in the public setting, it is very hard to perform. So I'm talking constantly to people here and there, finding ways to subsidize the service. I'm not there yet, but I hope to eventually make these tools more accessible to the general population.
So, systems-based practice, I think, is as critical as surgical skill, especially in high complexity oncology and robotics programs. How did collaborating with our team in Miami influence your approach to patient care or surgical technique?
I think it is very valuable to step out of the comfort zone and see how things are done um, in other places, because the more perspectives you gain about something, the more complete your understanding becomes. So, uh, as for the question, collaborating with your team, sorry. Well, you, Dr. Gonzalgo, are an expert in red-sparing radical prostatectomy. Observing how you perform the public lymphadenectomies in patients and see how these outcomes went during follow-up of these patients was also reassuring. Also, not exactly from your team, but from the hospital team, I also saw some procedures from Dr. Najjar. So also I took some tips and tricks from the partial nephrectomies. Yeah.
It's wonderful to hear, and I think it's a common experience that can be explained when we can have this type of knowledge transfer. And look, it works both ways. I think for every visiting scholar that comes, our team also learns a great deal. So, one of the questions we have, also relates to culture, right, and human dimensions of care. Did you notice differences in how patients interact with physicians in the United States versus Mexico?
Yes, I think that everywhere you go, there are these patients that are highly inquisitive, and they like to read a lot about what they have, and they like to do some research. And this becomes a real challenge for the physician, because the physician must give clear answers that are easy to understand and reassuring. So um, I saw that in the clinics, a lot of patients knew already what they had, and they somehow knew what was next in their plan. So that was the main difference I saw. Patients were referred already with a diagnosis, in contrast to my practice, at least in the public setting. Um, patients are referred just with the symptoms, or just with an abnormal lab test. So one must do the whole diagnostic workup, and this may take a lot of time. So the way I saw that patients were different is maybe that um, the way the services function were more cost and time efficient, in contrast to my practice. This enabled, like, um, having access to surgeries quicker than having to study the patient from the beginning and having a diagnosis afterwards.
Great. And, as you noticed, it's a, finite amount of time for your visit, usually again in timing prior or around the time of the AUA annual meeting, which I think is also another very good combination for knowledge transfer and opportunities for learning. But Rigoberto, here's a question. Outside of the hospital, what did you enjoy most about your visit to Miami?
Well, I think Miami is a very vibrant, diverse, and culturally rich city. I saw that there was a lot of art, and the food scene was great. The places I visited were amazing. Also, some of the neighborhoods, the beaches were also very nice. I think Miami was a very good city, a very nice city. I have anything bad to say about the city. It was a nice experience.
Well, I argue that you may have been to some restaurants that I've not even tried in Miami. So, I hope you had a good experience as well, or it sounds as if you did outside of the
It
hospital.
was. Yes, it
So,
was.
now focusing on programs like the AUA Exchange, how do you see programs like this shaping global collaboration in urology?
That's a very good question because programs like the AUA Exchange, I think they create good opportunities for global collaboration by exposing participants or urologists to different healthcare systems, surgical approaches, um, institutional culture. And this somehow accelerates the exchange of idea, standardizes highly quality practices. And finally, but also very important, it helps to build professional networks that translate in the long term in academic and clinical partnerships. Um, at the end, I think these interactions don't just benefit the participants, but elevate the overall quality of patient care across the borders.
Rigoberto, what advice would you give to international urologists who are considering an exchange opportunity?
My advice would be just to simply take the opportunity. There's nothing to lose, and there's a lot to learn. And I think professional networks are very important. So my advice is just to take the opportunity.
Great. What's next for you? Do you have any projects or goals you're excited about in the upcoming year you'd like to share with the audience?
Well, yes. I have an interesting project here. I'm very focused in creating a urology residency program at my public hospital. I hope this works. So that's my main project right now. I hope it works, and that's also my main focus.
Great. And here's the last question for the program today. How has the exchange experience changed your long-term professional vision?
Mainly greater confidence in the red use sparing approach. As I said, I have begun integrating this technique into my practice, and I'm beginning to start the dissection from the posterior plane. Recognize that I'm still transitioning because of the anterior approach. So I think that every time I can, I advance one step further with every case.
Well, listen, that's wonderful to hear. And this has certainly been a fantastic conversation. Rigoberto, thank you for sharing your experience and insights about the AUA Exchange Scholars Program with our audience.
Thank you, Dr. Gonzalgo, and thanks to the AUA.
And stay tuned as we continue highlighting AUA Exchange Scholars from around the world here on AUA News Inside Tract. We'd like to thank all of you for listening.
This has been Global Perspectives, an AUA News Inside Tract podcast, brought to you by the AUA International Programs Department. For more information about AUA's International Exchange Program, visit auanet.org/exchange.